Okay. Good afternoon. We are this afternoon with Dr. Lindemans. Thank you for coming. Coming to the sixth board of the TransplantChild European Reference Network.
Yes, thank you.
As I'm going to introduce Dr. Lindemans as a pediatric bone marrow transplantation expert in the Utrecht Hospital in the Netherlands. She is also Associate Professor of Pediatric Immunology in the Utrecht Faculty of Medicine at the Utrecht University. The field of expertise in research is graft-versus-host disease, which is a harmful complication of the bone marrow transplantation pediatric patient. So thank you so much for coming.
Yes.
Just some,
You're welcome.
Some question for this. So could you just summarize or brief summarize how bone marrow transplantation has made evolution in the current status of the field of stem cell transplantation right now in your opinion?
So yes, I think there's been a lot of changes over the last couple of years, the last decade, and I think it's still evolving with that. Like every 2 to 4 years, I think you see big changes going on. I think stem cell transplant has been the cellular therapy that is maybe the oldest, but the improvements you see are in the use of the better use of agents, of chemotherapy, and I think now we see the prospect of moving towards more immunotherapy agents, and also tweaking the cellular therapies that we've got to not just bone marrow, but using them more carefully, graft manipulation, but also prior to transplant, better use of cellular therapy to improve the remission status of patients with leukemia before transplant, and also to tweak the immune system after transplant so that they're better equipped of keeping out infections and killing of any leftover leukemia cells. And in the field of non-malignant disease, I think we're moving much more from bone marrow transplant to maybe gene therapy, which is using the same techniques as CAR T-cell therapies, but just also improving the outcomes, I think, for these kind of patients.
Are we following all the pediatric transplantation, bone marrow transplantation hospital in Europe? Are all of us doing the same things? Is a heterogeneous practice, or how it's also the European practice compared with the US practice, for example, in bone marrow pediatric transplantation?
I think both in the US and in Europe there's very big differences from center to center, even not just Europe and the US. And I think there's a lot of belief still in transplant. Some drugs we're using the same way as 30 years ago. Some things we're learning over time while already implementing the newest stuff like CAR T cells. So I think we want to move on, but one of the things that we really also need to do is get together, trying to learn and do the same things, and that can only happen with collaborative efforts like the ERN TransplantChild.
So let's move on now to the regarding collaboration as the ERN. So as you know, TransplantChild is focusing rare treatment that many pediatric patients with many different rare diseases, they need a very, very sophisticated and specific treatment, as is pediatric transplantation. So what do you think about the rationale of the TransplantChild approach regarding this transversal approach, taking consideration bone marrow transplantation and lung or kidney transplantation, because we can think it's absolutely different, but do you think this transversal approach has an added value, or do you think it's what do you think?
Yeah, so to some extent I think it is absolutely different. On other aspects like the use of immunosuppressants, the immunosuppressive state of the patients after transplant are really quite similar, and also maybe getting access to cellular therapies against antiviral drugs or antiviral cellular therapies, I think it could be necessary in both groups. I think also over the few years that the ERN TransplantChild is now there, I think we do find that there are also a lot of similarities, and that we can that we can learn from each other and from these efforts. I also think that we made it ourselves quite difficult by being so broad over all these diseases and over all these. I think even more than other ERNs, we will need a lot of centers with a lot of expertise to cover ourselves on all bases and over all the rare diseases that we use this therapy of transplant for.
One example of you said of this transversal approach, or these things, that's common things that these synergies, the fact that solid organ transplant and bone marrow transplant have, is something we presented yesterday regarding this, the chance to induce tolerance using bone marrow cells or some cell therapy with solid organ transplant in order to get operational functional tolerance without drugs. You know, this is a very hot topic at this time in the field, and there are many basic research, but we still do not have a clinical project, clinical trial. What do you think about this in the future, in the short future? Do you think it could be
it could be like the ultimate futuristic combination of our collaborative efforts because I think some of the solid, especially combined solid organ transplant, like the multivisceral transplant, are so complicated because you're trying to do it in the context of the autologous immune system. That maybe indeed this could be the way, and it is, and you can only do that with collaborative efforts, and it will be the ultimate collaboration in trying to improve and trying to benefit from all the knowledge that there is to create tolerance.
So just Dr. Lindemans, just the last question regarding our network. What are you feeling about the network at the beginning? I mean, it's good, you know, it was not easy to. Yeah. But what is now your feeling for the short future, for the next 5 years? What do you think? Where we are? Where are we going?
So I think there's a lot of enthusiasm that was there in the beginning as well. It's still there. We've also experienced that it's that we could benefit from more support from governments, from our hospitals to actually do the work, because it also appears to be an enormous amount of work to get all the deliverables done, but to also see that we're actually going to be effective in improving the care for both solid organ transplant and bone marrow transplant. And for that we actually need to also to get bigger, and that will probably be the biggest challenge to be effective still within with the people that are involved, but also even increase over time and getting all these transplant centers that actually have the expertise that we need to show this roadmap, because that is, I think, in 5 years what we need to have this roadmap for therapy, but also for people to find the way in Europe from for the different rare diseases, the different transplants. Where do we go with a question? Where do we put that question, and where do we find the expertise? And I think that roadmap is something that still needs to be built and sort of rolled out over the next 5 years.
Optimistic, useful.
I think optimistic, and I think the enthusiasm is still there, and that is the most important. That the passion is definitely there, and I think I think we also benefit from a coordinating center that has all the different transplant and the bone marrow transplant setting there, and an enthusiastic group to lead this ERN forward.
Okay, thank you very much.